Like that?
That's good.
Okay. Okay, so yes, thank you for the introduction. So I am Cheryl Andrews, and I'm honored and privileged to be here tonight representing the Ontario Shores Foundation for Mental Health. First of all, thank you to Jacqueline and Patricia for nominating Ontario Shores. We're super grateful for your support and continued advocacy. We're always so grateful for the opportunity to spotlight the revolutionary care being provided at Ontario Shores, and more importantly, to share with you the difference that your support can make to the delivery of that revolutionary care, to ensure that the patients and families living with complex mental health challenges can access the care and find the hope and recovery that they need. As you may know, Ontario Shores Centre for Mental Health Sciences is one of 4 specialty mental health hospitals in Ontario, and it houses a multitude of programs and services. Less commonly known fact is that Ontario Shores does care for patients ranging in age right from youth, so 11 years old, right up until 99 or beyond, so right from youth to geriatrics. So a lot of people don't seem to know that, we find. And yes, while Ontario Shores is a hospital, so I know you're thinking funded by the government, there are many unique programs at Ontario Shores that are solely funded through generosity and exclusively with community support, so from groups like 100 Women Who Care. With Mother's Day right around the corner, let's talk about the Women's Clinic at Ontario Shores as one example of one of these unique programs that operates solely on community support. So without philanthropic dollars from donors and community groups like yourselves here tonight, the Women's Clinic would not operate, or other equally critical programs would be canceled. So women struggling with perinatal mood disorders, moms struggling with depression and anxiety related to pregnancy and postpartum, as well as women struggling with mood dysregulation related to menopause. These are the women seeking treatment and being cared for at the Women's Clinic at Ontario Shores. Statistics indicate that 1 in 10 women will develop an anxiety disorder during or immediately following pregnancy and childbirth. And the current wait time for treatment at our Women's Clinic is approximately 6 to 8 months. So an unimaginably long time for a mom at home with a newborn struggling with her mental health. By the time she can finally be seen, the severity of her mental illness is often at crisis level. So let's talk about Grace, for example. So Grace is a nurse at Labor's Health. After the birth of her 3rd child, Grace's mental health started to drastically decline. When she started to think about harming herself and or her children, that's when she says she realized that she needed actual help. The severity of her illness was taken lightly by both herself and those around her. When her symptoms became severe enough, she finally saw no other option but to drive herself to the emergency room at her community hospital. In addition to being diagnosed with postpartum depression, it was determined that Grace also suffered from post-traumatic stress disorder related to a history of relationship stressors. That is when she was referred to the Women's Clinic at Ontario Shores. There, Grace started meeting weekly with a social worker. At first, she found it very challenging to go back through her history and to relive all her past traumas. But when Grace started considering quitting her treatment, it was thinking about her kids and her role as a mom that gave her the strength that she needed to keep going. Grace says, "I did not want to repeat the intergenerational trauma on my kids. I want to be in a state where I can take care of them and provide a happy and healthy life for us all." Although emotional challenges still exist for Grace, she has developed positive coping skills and uses those challenges to self-improve. Grace shares her story because she wants people to know that it's okay to not be okay, that no one needs to live in denial, in fear, or in loneliness. That as a nurse, a mom, and a woman, seeking help, although not easy, was not shameful, and in fact is empowering. So your contribution tonight will help enable the expansion of services in the Women's Clinic. It'll help reduce the unacceptable wait times to help women like Grace access the care and treatment they need hopefully before they start thinking about harming themselves or their children. Your support for Ontario Shores and programs like the Women's Clinic will help ensure women and moms like Grace can continue to find the help, hope, and recovery they desperately need. Thank you.